Welcome back to the Lars Larson Show. Glad to be with you on a Monday night. I'll get back to your phone calls and emails shortly at 866-HEY-LARS. That's 866-439-5277. There are so many reasons not to like the idea of Medicare for all. It is just one of the most foolish ideas I've ever thought of. I mean, number one, do you really want the folks who so inefficiently run things like the U.S. Postal Service, the DMV, and Amtrak to be in charge of your medical care? No. Do you want the government to have a financial dog in the fight in your early demise? No, I don't want that either. Do I want to have a system like Canada where people spend inordinate amounts of time waiting for the kinds of medical treatment that if you get to the problem early, you may live, but if you get to the problem late, the fact is you're more likely to die? No, I don't want them to do that either. I think all of it is crazy, and that's before you even get to the estimated cost of, say, Bernie Sanders' plan at 10 years equals $33 trillion, or about 75% of the entire federal budget every single year. That all seems crazy, but I thought we'd get Chris Jacobs on, who's founder and CEO of Juniper Research Group and author of the upcoming book, The Case Against Single Payer, How Medicare for All Will Wreck America's Healthcare System and Its Economy. Chris, long title, but very important as we head into this 2020 presidential sweepstakes. Welcome to the program.
Thanks for having me, Lars.
Is it fair to say that all of the Democrat candidates, the whole clown bus of a couple of dozen of them, are in favor at one level or another of Medicare for all?
Yeah, I think that's right. The question is, does the left hand know what the far left hand is doing? Joe Biden's trying to portray himself as the moderate in this, socialism convention, but really, his quote public option that he supports. There was an estimate from the Lewin Group back in 2009 that said 119.1 million people would lose their private coverage under this plan. That's the moderate option, and it gets worse from there.
119 million. And when you say lose, they'd be forced out of the plan they have now, which they may be very happy with, the one they get through work or the one they buy with their own money, and onto a government one-size-fits-all plan.
That's exactly right. Democrats have a tactical agreement. Democrats don't believe in a private marketplace. They have a tactical disagreement amongst themselves. Do we want to throw all these people off their health insurance right away, or should we do it more slowly over time? And so the public option that Joe Biden supports and other, quote, moderates support, that's ultimately designed to sabotage private health coverage and lead to single payer eventually, not just immediately.
Well, and am I right in hearing that the way you've described that, the reason it eventually leads to the end, the demise of private health care, is when the government offers something, they can offer it below the actual market price because most government agencies can lose money with the best of them, whereas the private company has to actually make a profit or at least break even, like most nonprofits do. They have to at least break even, but the government can just lose money endlessly. So anytime you're in competition between someone who has to either break even or make money and someone who can lose money all day long, the lose money all day long option is always going to win the day.
That's exactly right, and I talk about this in the book. There are multiple ways where these so-called moderate options sabotage private coverage. Number one, as you mentioned, they have a tap on the Treasury for billions of dollars of taxpayer funds or an automatic bailout if they run into any financial difficulties. The government plan pays doctors and hospitals much less than private insurance pays them. The government plan already has a doctor and provider network. They don't have to go out and leverage the private market to try to sign up doctors and hospitals. What do we see right now with the current Medicare program? We see government-run Medicare and Medicare Advantage private plans. Well, when you turn 65 and you sign up for Medicare, you're not put in the best plan. You're not put in the cheapest plan. You're not put in the plan that's best for your medical conditions. You're put in the government plan. Why might that be? Let's think about this.
Yeah, and in fact, I've found I have a couple of friends, Chris, who on principle have said, I will not sign up for Medicare, and they have the money to buy their own coverage. And then they go out and they find out there are whole ranges of services that they're denied. They walk into an urgent care clinic and say, I'd like to get treatment. And they say, well, you have to pay for it. Yes, I do. Where's your insurance card? I don't have one. I'll be glad to write you a check or, present cash or a credit card. And they're told, I'm sorry, we can't treat you. And I mean, I've literally have a friend who's in her 70s who says, I will not sign up for Medicare. I don't believe in it. I have the money to buy my own care. And she's actually denied care because of the fact that she can afford to pay her own and she wants that choice. And she's denied it because of and that's under the current Medicare. I can imagine that under the new one, would an individual even be allowed to buy supplemental coverage to get better than what the government puts in its one size fits all?
So under the Bernie Sanders plan, Medicare for none, you cannot have any supplemental insurance. You cannot buy all private health insurance would be abolished. Unlawful is the term they use. Believe it or not, the Medicare for America plan, which is Congressman O'Rourke supports this, the Center for American Progress supports this. They would go even further and ban all private health care. You could not go, as your friend tried to do, no matter what your age, you could not go to the doctor and say, I've got a flu, I've got strep throat, here's $50, $100, would you treat me? That would be prohibited. That private doctors that treat their own patients cash and carry would either have to hang up their spurs, they would have to agree to treat all their patients for free, or they would have to join the government plan.
So that sounds a lot like Great Britain, where effectively the only way you can be a private doctor is if you are 100% private and you have no patients from the National Health Service. But even under that case, would this Medicare for America plan, would that actually allow even a doctor to say, I'm going to hang out my shingle for rich people who can come to me and I don't have to take part in this at all? Or would that be illegal?
That would be illegal. And that's actually worse than Great Britain. Great Britain, believe it or not, Lars, there actually are some doctors that work for the NHS in their day job and then moonlight as private consultants. That is permitted under the NHS, their socialized medicine. That would be prohibited under both the Bernie Sanders plan and this Medicare for America plan. No private health. Under the Sanders plan, you could go in totally private cash and carry only if you treat cash pay individuals.
Which means that when the government's in charge of it and they're paying the bill and they say we're short of money, and they will be short of money because they don't manage very well, they're going to say, well, the way we'll save money is by delaying people the way Canada does, right?
Right, paying doctors less or denying patients care. We've seen this time after time after time. Donald Trump was over in Britain 2 weeks ago and talked about whether there was a controversy in Britain whether or not the NHS would get thrown into a U.S.-UK trade agreement. And all the British politicians said the NHS is not for sale. At the same time, there's a controversy where the National Health Service is denying patients cystic fibrosis drugs, cancer drugs, not because they don't work, but because they're too expensive. I said, Britain, you can keep your NHS. I don't want it, thank you very much.
No, and I don't want a system, by the way, that if you diminish the payments to doctors and nurses, then the top talent will say, I'm not going to medical school. I don't want to get stuck working for the government as a drone at the same wages and not able to make a decent living. I'll go take my talents elsewhere. And believe me, most of the people smart enough to be nurses and doctors are perfectly capable of doing that. Chris, thanks very much. We appreciate your expertise. That's Chris Jacobs, his new book, The Case Against Single Payer. You've got the Lars Larson Show.